Hello and welcome to my first lecture on the esophagus. So if you've got difficulty swallowing, that's called dysphagia. And you always want to do a bare minima before you scope, and I'll go through why later. If you've got dysphagia to solids and then solids and liquids, so it progressed, that means cancer. If it's always been equal, you've got achalasia. If it mimics the acute coronary syndromes with the chest pain, and the nature of the chest pain, that's very similar to acute coronary syndromes. That means you've got a diffuse esophageal spasm, likely. If you've got regurgitation of food with a really bad breath, that means you probably have a Zenker's diverticulum. So, as for achalasia, it's caused by an aberrant structure of the lower esophageal sphincter nerves. So you lose the ability to relax the lower esophageal sphincter and the inhibition that's usually there. It can be idiopathic, it can be caused by Chagas or lymphoma. The treatment is pneumatic dilation or surgery. Gastric carcinoma can be squamous cell or Barrett's. Remember that squamous cell would affect the upper 2/3 of the esophagus, whereas Barrett's would affect the lower 1/3, and that has a lot to do with its etiology. Squamous cell is a tobacco caused by tobacco, whereas Barrett's is caused by reflux, and it's usually found in obese patients who consume foods that lead to those changes in the lower 1/3. So after you scope, you need a CT scan and then do an endoscopic ultrasound for staging. Diffuse esophageal spasm shows high intensity disorganized contraction, and on the manometry, and the treatment is with calcium channel blockers and nitrates. And Zenker's diverticulum is the presentation of bad breath on regurgitation of food, and it's caused by the pocketing of the posterior pharyngeal constrictor muscles. And this one, I mean, you're not supposed to begin with the scope, but you really don't want to begin with the scope in this case, because if you perforate, you would cause Boerhaave, which is the thing that we're always afraid of. You want to get a good idea of the anatomy on barium studies, and if you do scope a Zenker's, if you perforate, the patient will have crepitus, subcutaneous crepitus, and perforation of the esophagus, which for then you need to go in for surgery. Thank you for watching. Please check out my other videos, and of course, please subscribe.